We now know that recovery is the guiding principle in mental health in terms of supporting people to achieve better outcomes in their lives, to get back to the kind of lives that they want to live. We know that that's underpinned by people's own lived experience. And one of the most common and important applications of lived experience is peer support working. And a peer support worker is someone who uses their own lived experience, their own experience of maybe using services, of living with mental health distress and recovering. And they use that then to support someone else going through a similar experience. And the key to peer support work is that they don't come with an agenda. They just provide a space for the other person to explore their own mental health. And really, recovery is about getting a new understanding of your own mental health challenge and what recovery might look like. In my own experience, I was many years on the treadmill of relapse and recovery, but never achieving, full recovery in my life. And what helped me make the breakthrough was peer support working. When a person came to me who had similar experiences to me and was able to set me some internal questions, that were really able to progress my recovery, I realised, that I had to become a partner in my own recovery. And I think that's the great benefit that I would see for teams is that, peer support working, can empower people, to understand that their own mental health story better and move towards recovery.
Starting a new job for anybody can be a challenge, and it can be particularly challenging for a person who previously used the mental health services to then work on a team in the mental health services. So on my first day I was introduced individually to each team member, and then in the first week I did some shadowing with the community mental health nurse, with the occupational therapist, and we were able to have conversations around how they work, their values, and how the values of peer support could align with their way of working. So one of the other things that helped was that a lot of the team members had previously done the Recovery Principles workshop. So they were very much in line with the idea of recovery, with the idea of reconnection to community, with the idea of instilling hope. And that really helped, because I think the ethos of the team is extremely important, especially for a team that wants to take on a peer support worker. Some of the small things can be very useful to welcoming a person into a team. One of the things that's very useful on the team that we work with is that we have a rotating chair of our multidisciplinary teams every week. So there's a real sense that the teamwork is owned by everybody and we all play our part, and that ethos and value really does filter throughout the team and in the way we support people. So I certainly think role clarity is very important. Peer support workers work on a set of values, and those values are recovery principles. Those values are about instilling hope and connection, and also about helping a person to reconnect with community. Something else that's very important, to make sure that peer support work as a project is sustainable, is to make sure that peer support workers have the chance to connect with other peer support workers, to share experiences, share learnings, share knowledge, and to feel that they're part of a bigger community.
As a nurse, I have worked with peer support in the last 7 years in community. Peer support is lived experience, and I see the value of a peer support worker on the team. I see the impact it has on service users. I see the trust and the communication between service user and peer support worker is invaluable to any team and to the service user. They interact with the patient on a different level. Our peer support worker also interacts with the patient when they're an inpatient as well, to follow up on discharge, which I think is invaluable as well. It's continuity of care. Anyone I've key worked that is involved with a peer worker has actually benefited greatly to feel that somebody gets them, is what I've been told. Somebody knows where they're coming from, and there's that loyalty and contact and communication that's invaluable to any service user who's involved with a peer support worker.
When a new team is involved in peer support for the first time, I think it's really, really important that the team members have an understanding of what peer support is, and maybe even more importantly, what it's not. That can happen in a number of ways. It can happen with maybe contacting teams that already have peer support workers, and it's really important, based on my own experience when we started in Mayo in 2012, it's really, really important to have people already on the team that are clued into that. As in, when we started, we had a consultant psychiatrist, we had a senior social worker, and we also had an OT manager who were totally clued on and bought into the idea, and I think it's no coincidence that's why it has thrived in Mayo. We are able to devote that bit more time to the people we support. I'll give you an example of somebody I supported years ago, and a nurse had come by at one stage and they'd said to me, "Are you like the nurses?" And I just turned it back on themselves and I said, "Well, what do you think?" And they said, "No, you're not, because you probably have a little bit more time to listen to what's going on." So I think that really, really caught what the difference is. Nurses probably don't have the time to spend that we do. That's a major difference. I openly would admit that I've had a lived experience. Now, I'm not admitting that I know everything, but I certainly have a lived experience of what people go through, the trauma involved and all the rest. And I also realise that lots of other members of staff could have that, but maybe it's not always discussed the way that we do as peer support workers.
In the Adult Mental Health Unit in Mayo, peer support has been a great addition to the services. So within the last few years, it's been 2 days a week, so coming in on a Tuesday and a Thursday morning. It can be one-to-one or it can be group. And most service users, I think, prior to meeting the peer support worker, would have had no idea about that it was available or what it was about. And so a lot have, taken the opportunity to look to self-refer themselves. It's the connection, one-to-one individually with somebody, so because it's enabled them to, get out of the unit. It's kind of moving on, it's a step out. And then the secondary part of that is the feedback that they're getting from the service users as well. And, this is another tool in the toolbox. This is something that, something different to try for somebody else, so, can this be of help? Is somebody looking for, to go for that walk for them, that time, so just to take advantage of that,
I suppose one of the ways that we find of building relationships, obviously we're trying to build trust, but I suppose we're starting at quite a level playing field in terms of we're coming in with our own lived experience, and that doesn't get you an automatic pass, I suppose, but it certainly starts to build trust at a different level, I think, than maybe somebody with more clinical experience. So I think that's one of the things that highlights the benefit of a lived experience role, is that you're coming into that relationship at a more level playing field, and you can draw on your experience to kind of build that trust and build that relationship.
Well, we've had a peer support worker on our team since 2017, so we've a lot of experience of working with peer support workers, and it's invaluable. Our peer support worker engages with people who generally would have traditionally had a lot of difficulty engaging in clinical areas, and we've had a lot of success with good engagement using peer support work and the model. Often it won't be in a clinical setting, it'll be outside of core clinical settings, a little bit more time, a little bit more relaxed, green spaces, walking in wooded areas, walking and talking. And sometimes not an awful lot of talking is done. It's being present with somebody, being with somebody down by some water in a blue space, and that feels very unthreatening and very safe. And yet there's work being done, that level of engagement to be done. And that's what's happening. We're seeing this then as we're going through the iterations of care planning, recovery planning, and had success with people moving from rehab recovery. And yeah, the therapeutic relationship is forming at a different level with peer support work. But the peer support worker attends our team meeting every week. And the lived experience, I think, gives us room to pause sometimes as clinicians. Certainly when we hit a clinical conundrum, sometimes the perspective of that lived experience is very important. So we find that very helpful in my team and in other teams that I've just got to interface with as well, of peer support work in our area.